You went to bed last night feeling completely fine. No chest pain, no shortness of breath, no warning signs whatsoever. But while you were sleeping, your brain may have been quietly starving for oxygen, and not because of a disease, not because of a medication, but because of the exact angle your head was resting at when you closed your eyes. I need you to hear this carefully, because what I'm about to tell you has nothing to do with your diet, nothing to do with your exercise routine, and almost certainly nothing your doctor has ever brought up at a single one of your checkups. My name is Dr. James Hargrove, and I've spent over 30 years studying cardiovascular and neurological health in adults over 60. And in those decades, I have watched one silent pattern destroy more brains and hearts than almost any other single factor in senior medicine, and almost nobody is talking about it. The way you sleep, the angle of your neck, the direction your body faces, even what you ate 3 hours before bed, is actively determining how much blood reaches your brain every single night. And here is the part that should stop you cold. Stroke risk peaks in the early morning hours after waking, with a 49% increase between 6 in the morning and noon, driven by what cardiologists call the morning blood pressure surge. That is not a random statistic. That is biology with a clock on it. And what happens in the hours before that surge hits, how you slept, what position your body was in, whether your cardiovascular system was actually recovering or quietly straining all night. That is what decides whether your morning is uneventful or whether it ends in an ambulance. So before you wave this off and tell yourself you have slept this way your whole life and never had a problem, I am asking you to stay with me for the next 20 minutes, because I am going to walk you through 6 sleeping mistakes I see in seniors every single week, ranked from mildly harmful to genuinely dangerous. And then I am going to give you the 2 evidence-backed positions that could be doing your brain and your heart a real favor starting tonight. But right now, before we go any further, do me a quick favor. Drop a comment below and tell me whether you sleep on your back, your side, or your stomach. I am going to be referring to all 3 throughout this video, and your answer is going to matter very soon. Now let me give you the framework before we dive in, because understanding the why is going to make every mistake on this list make sense. When you were in your 20s and 30s, your blood vessels were elastic. They stretched, they adapted, they compensated. You could sleep face down with your neck twisted at a 45-degree angle and wake up with nothing worse than a stiff shoulder. But here is what changes after 60. Your arteries gradually stiffen. The small vessels that feed your brain become less flexible. The pressure inside your skull becomes far more sensitive to changes in body position. And the autonomic nervous system, the part of your body that regulates blood pressure automatically, becomes slower to respond, especially at night. Healthy sleepers experience what we call overnight blood pressure dipping, a natural 10 to 20% drop in blood pressure during sleep. That dip is protective. That is when your cardiovascular system actually recovers from the day. But when your sleep position is wrong, when it compresses the wrong vessels or restricts the wrong airways or tilts your blood flow in the wrong direction, that protective dip gets disrupted. And what fills the gap is something far less friendly. So with that framework in mind, let us start with the first mistake. Mistake number 1 is sleeping completely flat with no head elevation at all. This sounds so harmless that most people roll their eyes when I bring it up. No pillow or just a thin one, body perfectly horizontal, spine supposedly aligned. Mattress companies build entire ad campaigns around it. But here is what nobody tells you. When you lie completely flat after the age of 60, blood does not redistribute the way it does in a younger body. Cerebrospinal fluid, the fluid that cushions your brain inside your skull, can pool. Intracranial pressure edges upward, and the tiny vessels in your brain that have been quietly aging for decades are now carrying slightly more pressure than they should for 7 to 8 hours straight. A study published in the Journal of Clinical Sleep Medicine found that even modest head elevation, as little as 15 degrees, led to measurable improvements in intracranial pressure and nighttime blood flow. Now here is the symptom most seniors completely misread. You wake up at 3 in the morning with a dull, throbbing headache, maybe behind your eyes, maybe at the base of your skull. You tell yourself you are just getting older. Headaches happen. You sip some water, maybe take an ibuprofen, and roll back over. But that headache may be your brain telling you the pressure inside is too high and has been too high for hours. The fix is not complicated, and I will show you exactly how to do it before this video ends. Mistake number 2 is stomach sleeping. the position that quietly twists everything wrong. This one surprises almost every patient I bring it up with because stomach sleeping feels like it should be harmless. You are not putting weight on your heart. You are not compressing your lungs. It is just lying face down. What could go wrong? The answer is your neck. When you sleep on your stomach, you physically cannot breathe with your face buried straight into the mattress. So what do? You rotate your head to one side, almost always the same side, every single night, because we are creatures of habit. Now think about what that means structurally. Your neck is rotated up to 90 degrees for 7, 8, sometimes 9 hours per night. And running along the sides of your cervical spine are two arteries called the vertebral arteries. These vessels carry blood directly to your brainstem, your cerebellum, and the parts of your brain responsible for balance, breathing regulation, and coordination. When your neck is rotated significantly to one side for hours, those arteries can become kinked. Think of stepping on a garden hose. The flow does not stop completely, but it becomes restricted. And restricted blood flow to your brainstem, 8 hours a night, year after year, is not something your body simply shrugs off. Research published in the Journal of Manipulative and Physiological Therapeutics confirmed that extreme cervical rotation measurably reduces vertebral artery blood flow velocity. There is also a second problem with stomach sleeping that nobody talks about. Your rib cage is pressed against the mattress. Every single breath you take all night is a breath fighting against compression. Your diaphragm cannot fully descend. You never reach full tidal volume, the deepest, most restorative breath your lungs are capable of producing. Lower oxygen per breath plus a kinked artery, both happening at the same time, every night. For a 35-year-old, the body compensates without breaking a sweat. For a 68-year-old with even a touch of high blood pressure, this is a slow-motion problem accumulating in the dark. I had a patient named Margaret, 71, retired school teacher, who came to me with morning vertigo so bad she could not stand up from the bed without holding on to the wall. We tried everything before I asked the simple question, "How do you sleep?" She slept face down, head turned right, every single night for 40 years. Within 3 weeks of switching her to her left side with proper pillow support, the vertigo was gone. Not reduced. Gone. If you are still here with me and finding this useful, take a moment right now to type the number 2 in the comments. It tells me you are watching, and it helps this video reach more seniors who need to hear it. Mistake number 3 is stacking multiple pillows under your head. I want to stay in the neck region for one more minute, because the next mistake is one people do with the best of intentions, and it creates a very similar problem through a totally different mechanism. Stacking pillows. 2, 3, sometimes 4 of them all under your head. People do this for real reasons: acid reflux, sinus drainage, breathing trouble, snoring. And a small amount of elevation does help with some of these issues. I am not dismissing that. But here's what happens when that elevation goes too far. Your head gets pushed forward significantly. Your chin tilts down toward your chest. And that forward bend of the neck, what we call cervical flexion, is exactly the position that compresses the vertebral arteries we just discussed, but this time from the front. There is also a third vessel that gets overlooked here, the internal jugular vein. This is your brain's primary drainage pathway. It carries used, deoxygenated blood and metabolic waste back down from your brain toward your heart. When your neck is bent forward excessively, the jugular drainage pathway becomes partially obstructed. Blood drains less efficiently. Pressure inside the skull builds slowly, and your brain's overnight cleanup work, the work that determines how clear your thinking will be tomorrow, becomes compromised. You may notice this the next morning as brain fog, a heaviness behind the eyes, a frustrating feeling of waking from 8 hours of sleep and still not feeling rested. You are not lazy, and you are not getting lazy with age. Your brain may have literally been waterlogged overnight. The correction here is one pillow. One properly contoured pillow, ideally a memory foam cervical pillow that supports the natural curve of your neck rather than forcing your head into a sharp angle. Many of my patients have reported their morning headaches disappeared within 7 days of making this single change. One pillow. That is it. Before I show you the next mistake, if this is helping you rethink how you sleep, hit the like button so this kind of practical information can reach more people who keep waking up tired without knowing why. And tell me in the comments how many pillows you currently sleep with. 1, 2, 3, or more. I read every comment, and I am genuinely curious how common this habit is in this community. Mistake number 4 is right-side sleeping if you have any cardiovascular history at all. Now we are getting into territory that is going to surprise a lot of you, because side sleeping in general is considered one of the better positions, and for most people it is. But, and this is a big but, the direction you face matters more than most seniors realize. Your heart sits slightly left of center in your chest. It has a natural orientation, and when you lie on your right side, gravity pulls your heart slightly away from its optimal resting position. More importantly, your body weight compresses the right side of your torso, and the inferior vena cava, one of the largest veins in the body, runs directly through that region. The inferior vena cava has one job: return blood from everything below your waist, your legs, your abdomen, your digestive organs, back up to your heart. When you compress that vein by lying on your right side, the return flow gets restricted. Your heart has to work against reduced preload, which means it is pulling harder than it should just to fill each chamber properly. For a healthy person, this is compensated for easily. But for someone over 60 managing borderline heart function, mild heart failure, or chronic high blood pressure, your heart is already running close to its ceiling. Adding nightly resistance is like running your car engine 10% harder every night for years. The cumulative